This is a video by the Department of Otorhinolaryngology, Head and Neck Surgery, Government Medical College, Kozhikode. COVID-19 is a pandemic gripping humanity worldwide. The lockdown has been beneficial by providing us time to prepare for a forthcoming calamity. With the increasing number of cases, testing becomes even more important, and number of tests to be done will only increase in times to come. The only way to win a long battle is to improve proficiency and ensure judicious use of available resources. We at the Department of Otorhinolaryngology, Government Medical College, Kozhikode come together in an attempt to train every person of this institute in taking a nasopharyngeal and oropharyngeal swab. The coronavirus resides in high concentrations in the nasopharynx, and therefore nasopharyngeal swab is preferred over oropharyngeal swab. The specimen should be collected within 3 days of symptom onset from patients meeting the case definition. Nasopharyngeal swabs are specifically manufactured to have long flexible shafts made of plastic or metal. The tips are made of Dacron, rayon or flocked nylon. It is necessary to check and ensure that you have all the appropriate supplies and arrange them prior to starting the sample collection process. It is essential to don the PPE, the personal protection equipment, correctly and follow the pertinent respiratory and contact preventions as per guidelines. If possible, one must don and doff the PPE in the presence of an observer to ensure that there are no breaks in technique that may pose the risk of contamination. All samples must be labeled and requisition forms filled appropriately before starting the procedure. All the patients who require the nasopharyngeal swab specimen to be taken must enter the room with a mask. The patient is asked to remove the mask and a tissue provided to blow the nose of all excess secretions, after which the tissue is disposed of appropriately. The patient's head is slightly tilted upwards to make the nasal passages more accessible. The distance of the nasopharynx from the nostril is roughly equal to the distance between the nostril and the outer opening of the ear. The swab stick is removed from the packaging. If possible, rest the head against the wall or a surface to avoid unnecessary movement during the procedure. The swab stick is now introduced along the floor of the nasal cavity as close to the nasal septum as possible. While introducing, if you meet any resistance, slightly withdraw the swab stick and then introduce it along the floor of the nasal cavity, probably changing the angle slightly more medially. However, you introduce it posteriorly till you meet the resistance which is in the nasopharynx. The swab stick is left in place for a few seconds so as to absorb maximum secretions, and then you remove it by gently rotating. In order to obtain an oropharyngeal swab, the procedure remains the same till you remove the swab stick from the package. If you can visualize the oropharyngeal inlet and posterior pharyngeal wall, you ask the patient to open the mouth and introduce the swab stick in order to touch the posterior pharyngeal wall and rotate it 2 to 3 times so that it touches both the tonsils and the posterior pharyngeal wall, and the swab stick is then removed. In case of patients where it is difficult to visualize the oropharyngeal inlet, you may have to depress the tongue using a disposable spatula and repeat the procedure as explained. The swab stick is immediately put into the collection tube, which is the viral transport media, and the swab stick is broken at the groove. The remainder of the swab stick is disposed and the collection tube secured. The collection tube is then put into the biohazard bag and all the specimens collected are together taken to the appropriate laboratory. This video is a small attempt to help train every healthcare person to be technically competent in taking a nasopharyngeal and oropharyngeal swab. The more you sweat in peace, the less you bleed in war. It is wiser that we train and equip ourselves to conserve our resources in the battle against coronavirus. Thank you.